Hi, this is Jannelle and the Better Health.
Hi, this is Jeffrey Bodin. Um, I'm
Hi,
call
Miss Jeffrey. I,
hi-
I I have you on my list. Just for HIPAA reasons, what's your date of birth?
052297.
All right, and for HIPAA, and just to let you know, this call can be monitored for training and quality purposes. How can I help you, Mr. Golden?
I called a food company this morning. I haven't gotten heard back from them, but I contact
What type of company? I'm sorry.
one of the food like delivery kind of companies. I found
Okay.
I found out through Google and through getting directed to them that there's that you just need a Medicaid meal waiver from Aetna. I just need the Medicaid meal waiver to be provided so that it can get filled out, which I think is a process that happens on y'all's end. Um, and
Right, that's what we're doing right now. Yes.
yeah, and that the LDH doesn't handle that Medicaid meal waiver. That's something that y'all can do entirely on your own. Um, and I'm supposed to
Who
if I
stated
just
that?
uh, it's
I'm sorry.
it's for all the states. It says if I just receive Medicaid, I just have to ask my representative for the meal waiver application in general.
No. So
And then I can,
no. So
and
it
then you can
it
apply for it through this company because they ship to every state. They're not a waiver program for the state of Louisiana. They're independent of that and Medicaid billed exclusively. So it's like they'd already be a Medicaid contractor that y'all could just talk to directly and not have to add them as a Medicaid contractor like y'all are trying to do with some other companies. They're already specialized in that, I guess, like federally. So you wouldn't have to worry
in
about it.
Louisiana is
And Louisiana is one of them. Yeah, I called their Louisiana director's number, um, and left a voicemail this morning at like 5 a.m. before I went to my appointments, and I haven't heard back from that. But I wanted to make sure to touch base with you, so that maybe you could
yeah. Let
contact
me.
them or get or ask one of your supervisors or something for this Medicaid meal waiver application because it's definitely something different than a state of Louisiana thing. This is just like a probably like a Centers of Medicaid and Medicare Services type deal. I've never heard of this specifically myself either before I just saw it at the top of Google today. So I don't know how new it might be. I always thought it had to go through the state's like um, waiver programs, but it's very clear it doesn't have to. It just these guys might be one of the only people who provide uh, that type of a service. It seems like they're a ship to your door through FedEx meal kind of thing. Like you heat the meals up or something. So maybe like less meals or maybe like less choice or probably maybe less like on your plate and stuff than some of the local ones you could possibly contract yourselves through Aetna, probably through the state's waiver program. So I'm not saying like stop doing that, but this one is already in place and ready to go uh, in our state. Um, and they're only paid through by Medicaid and approved by Medicaid, and these guys are already approved and uh, might just be the only contractor that the feds set up. Um, Even if it's a very limited like selection, but like it it does there are selections that I could eat. I did check. There are 4 dairy-free meals. So this wouldn't be like a thing I'd be asking y'all to look into and then possibly have nothing available for myself. Uh, I know up front there are at least 4 options, uh, and that's it. Uh, Out of their 35 options in total, which I think, if it's the difference between getting something and not getting something, this is perfectly acceptable. I prefer more, but if I'm, I'd rather use the resources that are available, rather than have nothing at all. And I don't know what that form is to give to you, but I can give you the number of the director for Louisiana, and he might be a lot more helpful if you can actually get into contact with him directly if you want that.
And who is, you said this is the director of?
He's there. The company is called Homestyle Direct, and he's their case manager. Under their case manager section, he's the director of all of Louisiana.
Okay, let me reach out to I'm typing this as you tell me everything. I am typing this, sending this over to my manager right now, Homestyle.
I have a feeling he's like the Medicaid point of contact at an executive level from Louisiana's LDH and Centers for Medicaid and Medicare Services and their company. From like how they kind of have it formatted on the website, it looks like, because this also includes Medicare Advantage members, so it's not just Medicaid. It just, to me, it just looks like a straight federal exclusive contract and tailored service provider for just the feds, with like no in between that might have like one state needing to vote to have state funds appropriated or anything. It's got nothing to do with that. It clearly just bills straight through y'all, and funded by Medicaid and not by like state Medicaid or something like that. Which is definitely my circumstances, because I'm on Social Security, so I have no restrictions on funding. I can't get cut off or anything like that. So things like this, since it exists, I know for certain I can access it. I can't tell you if the Medicaid expansion members in Louisiana could access it, but I know for disability individuals who are entitlees on SSI definitely would meet the criteria for it, what this is, because there's no state funding appropriated, so there's no in between. And this guy, it's just a state director. His name is Doug Cleese.
Yeah, I'm looking at it. I'm writing his number down.
Okay.
I'm about to give him a call now. I did talk to Miss Peel. I believe that's your nurse. I had received your email yesterday about the neurology referral.
Oh, I think I got that handled, but I'm not sure. You guys should still look at that, just in case.
Yeah.
Because I did go to my primary care physician today, and I spoke with her about that. And she is trying to get me into the Access Healthcare Networks, which is the federal one for our state, neurology department in Slidell, for within the next 2 weeks, because I need to be seen like immediately, and she doesn't want me waiting at all, because she seemed to kind of agree that it was going to be a big delay if it happened at all, that I would see the epileptologists and associated academic kind of physicians that Ochsner has as a special team. I wouldn't mind seeing them, but they did not call me on Tuesday, even though they assured me on Monday that they would call me, and that was and then right after that, like that night, is when I emailed you and spoke with the voicemail. And I still have not even to right now heard back from Ochsner, and my patient portal didn't update, so I don't have any appointments scheduled. So they didn't do what they said they were going to do, which was immediately give me an appointment. They just canceled my appointment, and they definitely could have treated my epilepsy at that generalized like clinic. They just aren't. So I guess I have to find somewhere else. So I'm hoping that it works out with Access Health, but I haven't had an appointment scheduled with them either. So until that happens, which I'll try to let y'all, I'm gonna call you immediately if I get an appointment scheduled, just so that you guys can like not have to work on that anymore, so that it'll free up resources. I don't want you guys, pursuing a new neurology appointment for me if I've already got one locked in.
Okay.
I mean, you can still look at like talking to Ochsner and trying to, have them as some, figure out what happened with them, and for
now,
just.
I do
But
tell
if that's not
members,
something that
but
is going to handle, then y'all don't have to. I'm not like upset about it or anything.
Yes, sir. And I do tell members, I don't know what it is about the North Shore, but they're very limited with Medicaid, or they either don't take Medicaid. Now, if you want to stick with Ochsner, you can, but you would have to travel to New Orleans or Jefferson.
This clinic was in New Orleans. It was the West Bank. It was the West Bank Neurology Clinic was what canceled on me. Didn't want to see me for epilepsy, even though they see epilepsy as one of their primary things. They wanted me to go to somewhere even more specialized than that, which would also be in New Orleans. And I don't have a problem going to New Orleans, but I've basically gotten pushed out of every normal New Orleans neurology clinic over the years. And I started with Ochsner with their pediatric neurology, and that ended up getting shut down like while I was like leaving it, I guess, so I'm not like the only patient that had problems with that, but I was with them for years and years and years, most of my life. So I definitely don't mind them. It's just I've never thought that I guess at this point their neurology setup definitely they need to incorporate an entire hospital building, in my opinion, like UMC has kind of, and LCMC handles with like those giant buildings that they have, instead of having these tiny neurology clinics everywhere that keep like gating the patients out, because neurology is a very it is a very like devastating thing for a patient to just no longer have a doctor when that's the only doctor potentially in the state, because they're so specialized. And you don't want them, and I understand, I don't want my doctors to feel uncomfortable trying to treat a patient that they don't actually see any patients like that patient at all, because that's a normal thing, especially in a subspecialty like neurology. They just need to have a big building that does it, like a hospital. They just don't have that, and they really should try to do that in New Orleans, because they have all of the neurology kids are around the lake, and I know a lot of us live on the North Shore, and we always went into the city to go to neurology, and everybody went to Ochsner because I was the only one after Katrina. And I don't know where everybody's going now, if people are getting pushed out of this clinic too. I'm just assuming that Aetna probably has to speak with them because of how it was expressed to me on Monday. It's just a very not acceptable thing, and it's definitely going to affect other patients too.
So they're not taking Aetna Medicaid or it's all Medicaid?
No,
Because
they're
it could
taking.
be where you're not,
They can take, and they work.
or it could be
They
selective.
just they don't want to take epilepsy patients. They don't want to treat epilepsy, and that's a
Okay.
very crazy thing to hear because you have to be able to treat epilepsy to, I am fairly positive, have board certification as a neurologist. However, I don't know the difference between a general neurology specialty and neurology. I don't know what the difference is between those two. They could be very, very different. In medicine, sometimes having the word general before or after a thing can change it like a huge change. I've learned that over the years, and I still don't know the difference there, but but like that's something to kind of keep in mind that like they might they're probably not straight up lying. There probably is some sort of a problem for why they for some reason can no longer treat epilepsy like on Monday, but last week when they spoke to me, they were completely confident on Wednesday that they could treat me and were happy to see me and had all of my records on file, had studied under my previous doctor, who is one of the actual foremost doctors treating epilepsy in this hemisphere, and one of the United States' only doctors who we sponsored from like the Cold War and up, and he's trained most of the neurologists in the United States who treat epilepsy. So like having another one of his students graduate and stick around in the area that's a reassuring thing to me. But like having her on like last week call me on after hours and speak with me for like half an hour about my records and stuff to establish care and be very confident, and then this Monday be not confident at all and like just cessate care and cut off, that's just very concerning. I don't know, maybe they lost some employees or something and they just can't treat a patient with epilepsy anymore. I don't know how that works. Maybe that's something y'all can help them with. It could be something like that. I have no idea. It would have been helpful if they could have just straight up told me that, if it was something like that, rather than just tell me that they didn't feel comfortable treating epilepsy when it's like, no, you definitely have the education and you felt comfortable treating me. There's something else going on. It just does, it doesn't make sense otherwise. Like, and I mean, I still have the ride service scheduled. Like, I haven't canceled it yet, just in case. A lot's gone on in the last 3 days. I was still hoping to keep the options open, irregardless of if I stay with them or not in the long term. I still don't mind going to the appointment, if they allow that, and just figuring out what's going on, if nothing else, to help transfer records to another doctor. Because they definitely have all the records. She was going through them all, looking at them all, and that's a very reassuring thing because Dr. Lenjek and his staff had a lot of records on me. They went through a lot of stuff from MD Anderson. They went through a lot of stuff from Children's Hospital. They went through all the early records of Dr. Jamie Morales, who was my first oncologist at Children's Hospital, who no longer practices in this state and was promoted out to a private research in Boston for the United States. So like I've had a lot of doctors see me earlier on in their career and move upwards by the time I ended up graduating high school and things like that. And it's not really possible to just have someone like call them and their staff at Children's Hospital because the staff's not there anymore. So having that continuity of records is something that it does concern me. So I don't really want that to just kind of disappear. I'd feel a lot more comfortable if Aetna could just get me to have them keep that appointment, just so we can establish a baseline and then move on from there, even if they really feel like they can't see me. For whatever reason it would be.
So, question: you was being seen at this clinic, and then they just told you that they no longer take Aetna Medicaid patients, or they don't treat
No, they didn't
epilepsy
say
no
that at
more?
all. They definitely did not say that. They just didn't want to. They didn't want to treat or see epilepsy patients. It said nothing. They said nothing about Aetna or Medicaid at all.
Okay.
Because they
But they had
definitely still
seen
see, and
epilepsy patients in the past.
they had seen them the
They
week
treated
before. Yeah.
Okay.
So something happened over the last weekend or something. That might be something that's easy for you to find out just by asking around, or not. It kind of blindsided me.
And what's the name of the clinic again?
I think it was the West Bank Neurology. Pretty sure.
West Bank Neurology.
I think, but let me like pull it up just for. I can give you the address too. That's probably the easiest thing. It was the. Yes, it was West. It was listed on the patient portal, so this is what they call it, I guess. Was West Bank Dash Neurology, 120 Oshner Boulevard, Suite 220, Gretna, Louisiana 70056-5248, US, 1504 595 8318.
Okay, thank you for that information. I could definitely follow up. And in the meantime, I'm gonna give this home style direct a call, because we do have a meal waiver, but our meal waivers are from long term and choices. We don't have nothing separate from that, so it's not a separate entity. Because if it was that way, if it was that easy, we wouldn't have no problem with getting you in and not going through the waivers.
I think this counts for choice, because they had on another part of their website when it was describing stuff, something about the choice thing. So you might want to talk to them about that up front, because I didn't know what that was, but since you mentioned it, it definitely popped up quite a few times. I just didn't understand what it was.
Yeah, because Medicare, we'll pay for the meals. They just have to be, you have to have like some type, it have to be long term, or it have to be choices. And then you get to pick what place that you would like the food to come from. Like, you don't have to go through the place that the lady I called through Health, I think it's Healthy Soul Food or something like that. We don't have to go through that particular company. You have a choice of what companies that you want to go through, as long as you have the waiver, as long as you approve for either a long-term or choice waiver. But I'm going to reach out just to make sure. I'm going to call the person, Mr. I think I wrote it down. Is it Lowe? What the guy name is? I just clicked on the state, and it gave me his information. Let me go back, because I was just looking at the website myself. And I have the number that's 785.
Yeah, 785-260-6017.
Yeah. So I'm going to reach out to them or him today and see what all the qualifications are. Have you say I think we spoke maybe a few days ago or last week. I know we talked about the long-term waiver. Did you get approved for that?
I'm
yet,
fairly
or
positive I sent you the like people that we could speak to about um that. She said that I don't have a case manager with the state, but it sounded like from what she said to me that day, um, that I definitely had wait, was that this week? Was that this Monday?
okay,
May have been this Monday. Lots happened this week. Yeah, it was this Monday. Um, it, she definitely it seems like you and the nurse you are both basically my case manager for the waiver, and y'all can call and probably should be the ones calling the numbers that were on that uh, document that I attached to you, that has all of
okay,
the companies. It's just that uh, like it's a on the patient side to actively contact each individual one and figure out which one of those fits, I guess, my needs, and then like cut a contract with them or accept it or something. I just didn't feel super comfortable doing that because I didn't know any of those companies. I didn't know their like operating parameters or anything. And I thought that
okay,
y'all would probably just be able to interact with them easier, and a lot faster than like me like calling them back trying to learn it and then possibly wasting everybody's time to an extent. I didn't really want to like get off on the wrong foot with a contractor that I would be working with for potentially many years, um, just because I had to like navigate the system on my own, um, because I won't be assigned a case manager. That was made pretty clear. The state just won't do it for what I was awarded, but I will almost certainly be getting the worker, and we just have to pick the worker. We have to contact those companies, and Aetna will decide. I'll just let you guys as Aetna decide which one you want to pick, and make the decision for me, based on like what you know
okay,
about my needs and things.
okay. All right. Well, I'm going to give this place a call, and I'm gonna just do some digging and research on that. And in the meantime, if you do have any questions, definitely give me a call. You can reach out to the nurse for more nurse stuff, like the neurology part. I'm gonna still follow up with the police and see what the deal is with that, as far as them not caring for epilepsy patients anymore. But if in the meantime, if you do have anything that's more medical, definitely reach out to the nurse. That's why she's on the case as well, because some of those things I don't know nothing about. So um, I reach out to this place right now. I'm gonna give them a call and see what I can find. Okay.
Okay, thank you.
All right. You're welcome. And if you, like I say, just reach out. You got my email. I don't know if you have Miss Peel. I think that's her name.
I don't have
Peel.
her email contact yet. I got yours because you
Okay.
contacted me through the email. If she could do the same
Well.
thing, and if she feels comfortable with that, and leave me like a contact, like like at the bottom, kind of like you did, that would be helpful.
Okay.
So I know how to contact her, but because I can just add her to
Okay.
future emails and things. I just didn't. She just hadn't provided that yet, so I was just following up with you as a primary, and just assumed you guys would basically be able to just like look at whatever was sent, because I thought you
Okay.
you guys worked pretty closely together.
Yeah, she's pretty new, but she's new with Aetna, so she's still learning some things. But we do
Okay, then
work
I
together. I'm
might
about to
just
send her a
continue to
message right now.
contact you as
You
a
can you can
primary just
contact
for
me, and
the.
if it's yeah, you can contact me, and if it's something that she needs to review, is it okay that I forward this email to her
Yeah, no.
until I
If
make sure
you
it's
send you work
okay?
as freely as you feel the need to work. I want the easiest workflow for you guys possible. So whatever,
Okay.
if you think it has to have my permission, just assume that I grant my permission for it, so that you guys can just work easier.
Awesome. Well, thank you so much for your time, Mr. Bodin. I hope that you have a great day. We're gonna just I'm gonna call this company right now and just kind of get some information about it to see what it is they offer, and if it has to come through any of those waivers with Medicaid, and if not, then we'll definitely just move forward and we'll find a good company that works for you. Okay.
Okay.
All right. You have a good day. Bye-bye.
Bye.